Okay, so today I will be talking about NHL, non-Hodgkin's lymphoma. So basically with this cancer, cancer cells may develop in the thymus, lymph nodes, bone marrow, or spleen. There can be a tumor in the lymph node, and they include your T cell and B cell lymphocytes. So in 2016, there were an estimated 694,000 people living with NHL in the US. In 2019, there is expected to be about a little over 82,000 new cases of lymphoma diagnosed in the US. So that's with 81,000 of NH and 74,000 with NHL. And for the 5-year survival rate for people with NHL, it has actually increased from 31% to 74% for all races from 2014 data that was collected. So, what exactly is non-Hodgkin's lymphoma? So over here with this Reed-Sternberg cell, so people who have NHL don't have this cell, it's not present in their body, but people who have Hodgkin's lymphoma have the cell. So non-Hodgkin's lymphoma is a type of cancer that's a part of the immune system called the lymph system. So it begins when a type of white blood cell, either a T or B cell, can become abnormal. So it may grow. So with lymphocytes, they are carried around the body in the lymphatic system and can collect in the lymph nodes or glands. So there were many stages of non-Hodgkin's lymphoma. So stage 1, the lymphoma is in one group, a part of the lymph nodes. Stage 1E is the lymphoma is just one area outside of the lymph nodes. For stage 2, the lymphoma is grouped into 2 or more groups, and either the lymph node/lymphoma will be above or all below the diaphragm. Stage 2E, lymphoma and the lymph nodes are all above or below the diaphragm and lymphoma spreads to the tissue near the lymph nodes. For stage 3, lymphoma is in the lymph nodes both above and below the diaphragm. Stage 3S, the lymphoma is in the spleen and lymph nodes above the diaphragm. And then stage 4, which stage 4 is the most dangerous. So lymphoma is pretty much widespread around the body, so to multiple areas, which include the lungs, liver, and bone marrow. So with this particular stage 4, it's often treatable. So with this stage, it's more life-threatening compared to other stages of NHL. The prognosis depends on many factors, which include the type of lymphoma and the age of the patient. So with this stage, it circulates around the whole entire lymphatic system, so your spinal cord, your lungs, and your liver. So for the symptoms of non-Hodgkin's lymphoma, they would include swollen, painless lymph nodes in the neck, armpits, or groin, unexpected weight loss, a fever. You could have soaking night sweats, coughing, trouble breathing or chest pain, and weakness and tiredness do not go away usually. And you either have pain, swellingness, or feeling of fullness in the abdomen. So you may experience either all of these symptoms or just a few of them. So how does the condition of NHL affect the exercise response? So patients may experience side effects that limit their ability to exercise during and after treatment, and they also may include the type and stage of cancer and cancer treatment and their stamina, endurance, strength, and fitness level. It is also recommended to not exercise with low red blood count or anemia. So, cancer and cancer therapy have the potential to affect the health-related components of physical fitness, which are CRF, also strength, endurance, your body composition, and flexibility will all be affected, and range of motion is also affected. So, how does exercise affect the condition? So, there are many positive effects of exercise for people who have NHL, it is important to exercise with this type of cancer. So there are acute exercise effects on the acquired immune system. So with the component T lymphocytes during moderate activity, cell proliferation decreases its levels 30 minutes post-exercise. During vigorous activity with T lymphocytes, there was a transient decrease in proliferation. So, which leads to, there are also effects of chronic exercise involving T lymphocytes, which then lead to exercising on a regular basis enhances cell proliferation even more. So, this is a continuation of how exercise affects the condition again. So, with aerobic exercise, it is shown to improve physical functioning and improve quality of life, which also includes individuals who go through chemotherapy. So, engaging in physical activity, exercise before having a stem cell transplant actually improves your cardiorespiratory functioning. And patients will also experience a decrease in fatigue, so they won't feel as tired as much if they participate in an exercise program during their hospital stay for a stem cell transplant. So, there were many pharmaceutical indications for NHL, so I found 2 of these drugs, so how they affect the exercise response. So one of these drugs, one is named Bendeca, so they may cause serious blood-related serious side effects, so they may lower blood cell counts than what is normally there. There is possible low red blood cell count / white blood cell count as well. So if you have less red blood cells, so you get tired easily, shortness of breath, and less red blood cells also can get infected easily as well. So you will more likely get sick when you have less white blood cells. So you also have trouble breathing with exertion during exercise, and you also have lack or loss of strength during exercise. And then with Aliquopa, there is a slower fast heart rate during exercise. So you also have trouble breathing, lack or loss of muscle strength, and you can have an increase in blood pressure during exercise, which may lead to dizziness or passing out. So there's also a low platelet count, which is a high risk of bleeding when your count is low. So you must avoid contact sports, which can lead to injury or bleeding. So there was some research done on the study right here. So they found that at least 56%, which is a little bit over half of this chart, people have NHL. Other types, which include multiple myeloma, which 18%, chronic lymphoid leukemia, 14%, acute lymphoid leukemia, 5%, and Hodgkin's disease at 7%. So as you can see, people who have NHL take up a little bit over half of this chart, compared to all the other diseases on this chart. And this chart over here, so it shows that the rate per 100,000 people who get non-Hodgkin lymphoma, so increased from the year 1975 all the way up until estimated 2020. So as you can see, they kind of all plateau off. So the rates seem to be about the same as what they're predicting it to be with this research. So as you can see, white males are more likely to get NHL compared to black males, and then white females are more likely to get NHL compared to black females, as shown in this study. And then for my case study, so Mr. Stevenson is 55 years old and is diagnosed with non-Hodgkin lymphoma. He currently is receiving treatment in a medical office. He's experiencing fatigue, swollen painless lymph nodes, coughing, trouble breathing, and minor chest pain. He is also currently active 3 days a week, but he stopped exercising due to his diagnosis. Since his diagnosis, he became depressed and less lonely. He has already undergone immunotherapy, which has affected his ability to exercise. He also has arthritis, which makes it even harder for Mr. Stevenson to exercise. So he wants to get back into exercising and engage in a safe exercise program, but he also wants to be able to manage the arthritis that he currently has. So for the exercise prescription that I made for Mr. Stevenson, so he should be at least 3 to 5 days a week of aerobic exercise at a moderate intensity of 40 to 59% of heart rate max. RP can be between 12 and 13. And then for vigorous, it could be greater or equal to 60% heart rate reserve, which is between 60 to 75%. And then for time, it should be at least 150 minutes a week of moderate, and then 75 minutes a week of vigorous aerobic exercise. And for type, it should include rhythmic activities like walking, cycling, swimming, low joint stress, aquatic exercises, since he has arthritis. For resistance exercises, he should be doing that at least 2 to 3 days a week. So start at a low resistance, so 30% of 1 RM, and progress to small increments if possible. And then for time, he should be doing that at least one set of 8 to 12 reps. And for type for resistance, he should be doing like free weights, machines, weight bearing exercises that are functional tasks, which include sit and stand, and body weight exercises. Then for flexibility, he should be doing at least greater or equal to 2 to 3 days a week, with daily being the most effective. So he should be doing flexibility almost all days of the week, but it's recommended to be doing at least 2 or 3 days a week. And for intensity, it should be at least range of motion of movement as tolerated. And then for time, between 10 to 30 seconds of holding it for static stretching. And then for type, he should be focusing on specific areas of the joint that result from treatment of steroids that he takes, and focus on all major joints as well. And for some special recommendations and modifications, so people who have NHL, slower progression is needed compared to healthy adults. So survivors who completed treatment can gradually increase exercise duration when tolerated and without exacerbation symptoms or side effects for all activities. And then those who are in an immune suppressed state should avoid swimming activities or those receiving radiation. And also, patients should stop exercising if symptoms of dizziness, nausea, or chest pain may occur. And exercising at home versus a medical center is advised more for cancer patients. And these are all my references for this. And then basically the take-home message here is, so if you're experiencing any of these symptoms and signs, to go to a doctor and just get checked out just to be safe. And also, if NSA runs in their family for family history, I would also get that checked out within 1 year, or every year, every couple months, just to keep up on that. Thank you.